Let's talk about the NCLEX ATI versus HESI versus UWorld versus Bootcamp versus Archer. If you don't know me, my name is Kay. I just passed my NCLEX PN. I am about to work throughout the summer as a med-surg LPN. I'm IV certified, and I am going to continue on to my 3rd and 4th semester of nursing school to then graduate with my RN. I'll start out by saying that my school does not use ATI. My school actually uses HESI. I'd have to take a predictor PN exam in order to actually go and take our NCLEX exam to kind of prove to the state that even though we weren't an LPN program, we were at the benchmark to be able to pass our PN. While the content was similar, it did not look anything like the actual NCLEX versus some other resources that I did use that I feel looked almost identical to the NCLEX. If you have used ATI or UWorld, please put it down in the comments below and let us know what you think about that, because all that I've seen online is that people really didn't like ATI and people were kind of hit and miss with UWorld. Bootcamp, however, I used only 3 days before the NCLEX, and I kind of wish that I would have used it earlier. Again, I did pass in 85 questions, so it's not so much of a wish I would have used it so that way I could have done better. It's just the way that Bootcamp is set up. You can actually do standalone questions based off of specific subjects, and I feel like that would have been really, really helpful for me because I went in there knowing that OB is not something that I'm comfortable with, and I don't perform very well on OB questions, and a lot of my NCLEX ended up being what my weakest subject was. It would have been nice to kind of tailor my studying more towards my weakest subject, just so that way I could have been more comfortable, because again, I didn't fail, but I wish I would have done that just to be a little more comfortable. On to Archer. I would recommend Archer to absolutely anybody. I only purchased the, I think, 30-day Q bank. It was somewhere around $60. I only had about 2 weeks to study for the NCLEX. I used Archer's readiness assessments every single day, and when I first started out, I was borderline. I had one low. I started listening to Mark K. I watched Beautiful Nursing's video on YouTube. By day 2 or 3 of using Archer, I was getting consistent highs to very highs, which, if you don't know, the assessments go from borderline, low, high to very high. And if you get 4 highs to very highs in a row, you have statistically, I believe, like a 98% chance of passing the NCLEX on the first try. If you're about to take your NCLEX, whether it's PN or RN, I really, really recommend, if you can swing it, to do Archer and Bootcamp. It helped give me some peace of mind, helped me to see what other question banks were saying and how they were wording their questions to know if I was truly on the right track versus only using one metric. I'm so excited for everyone about to take their NCLEX. I cannot believe that I am able to say that I am a nurse. I am a nurse right now. Praising God for it. I hope you found this video helpful. Please make sure to like it, comment in 9 words or more what you thought about it, or if you have any questions whatsoever about the NCLEX, make sure to save it for later. Follow me, of course, for positive nursing and nursing student content. Thank you so much for spending your precious time with me. Bye!